Hi, this is Angela with Angela's Nurse Toolbox. Let's talk about giving subcutaneous injections, choosing the correct needle length and gauge for a subcutaneous injection. Some common medicines that we give subcutaneously would be insulin and heparin, and some vaccines that we give subcutaneous. So subcutaneous means into the fat. Okay, so with our patients, when we are giving an injection, you're going to be giving it into the fatty part of the tissue. So sites are commonly the abdomen, the back of the arm, or the thigh. So when we pick our needle lengths, I'm going to show you a few different needle lengths. Okay, this one is a 25 gauge. Okay, so that refers to the thickness of the needle. I'm going to show you a comparison. Let's look at, I pulled this needle out. Do you see how much more thicker this is? Okay, so this one is a 21 gauge, so it's a lot thicker, wider diameter, and it's a lot longer. Okay, so this one would be given for an IM injection. This is the correct length we would need for a subcutaneous injection. So let's look at some other ones. Here's another one. This one is super short. This is 5/16 of an inch. It's very thin. A lot of times your patients don't really even have much pain when you're giving these injections. They might not even feel it because it's so tiny, these needles. Let me show you another one we got. And here's another one like on our insulin. Very, very short. So our common lengths of our needles, let me show you in just a sec, tend to be anywhere from 5/16 up to 5/8 of an inch if we're going to give an injection subcutaneous. Okay, I don't need a super long one if I'm just entering into the fatty part of a patient. So when we give it, our subcutaneous injections on our patients, we're giving it into the fatty area. So don't ever go tell your patient, I'm coming to give you an injection in your fat. Okay, they're going to be very, very upset. We tend to go at a 45-degree angle when we give the injections. If they are super, have a lot of adipose tissue, I use the term that they're fluffy. You can go in at a 90-degree angle. Okay, so anywhere from 45 to 90 degrees. And I always want to make sure when I am selecting a lot of our syringes, they come with just the syringe but no needle attached. We're the ones that have to go and select it. So don't go and pull a needle like this if you're going to give somebody something subcutaneous. Okay, that is way too long. That's like 1.5 inches. So always remember, the higher the gauge, the thinner the needle. Okay, and we want a very, very, very short needle for our subcutaneous injections. Okay, for our patients. If you like, follow my videos. This is Angela's Nurse Toolbox.